What's going on, everyone? Welcome to this week's episode of the Indy and Dots podcast. This week, we're joined by a very special guest. He is the owner of a successful osteopath clinic in Birmingham, named the Edgbaston Performance Clinic. He is the consultant osteopath for Aston Villa Football Club and Birmingham City Football Club. He's also the lead therapist for the PGA European Challenge Tour, and he is a senior osteopath for British Athletics. All of this has led to him being selected as a part of the medical team in the Rio 2016 Olympics and the upcoming 2020 Tokyo Olympics. Now 2021, whichever way you want to have it. His name is Poora Singh. Poora, how you doing, man? Thanks for coming on.
No, thank you for having me, man. Thank you very much. Yeah, I'm all good. Thanks. Setting up a couple of days' time, I'll be jetting off.
We can see that you're in like some kind of some outdoor kind of area. So I'm assuming you're isolating ahead of the Olympics.
Yeah. So we were advised by the BOA, the British Olympic Association, to steer away from as much as we can without them saying it openly. It's just basically just keep yourself safe, because currently this is my 72-hour PCR I've had today. I had a 96-hour, a 14-day, and I've had a lateral flow every day since last week. And all of those have to come back negative, and I have to keep a certificate of all of those. They all go into a pack when I get to the airport. There's Japanese authorities at Heathrow who will go through the paperwork. Then they look at your NHS app to see that you're double vaccinated, and then you're allowed to go into the country. Then you're allowed to get on your.
Then you're allowed to get on the plane. I was going to say, when you get there, you probably got to isolate again, haven't you?
Once you get off of the plane, really, wow.
Oh. This is more than I have.
Well, when I get off at the other end, it's going to change from PCR to
hospital,
saliva.
I work in a hospital. I don't have this
so I'll have a saliva test. When I get off the plane, there's a saliva test. You have to wait inside the airport until your test is done. And then you get a test release, so you can release. And then you have to download a Japanese app, which is like the test and trace. And then you have to download a second app, which is for Olympic staff, which... If you are stopped at any point, you press the button, it gives you a barcode, it shows that you're safe to be in the country. And then your visa lasts for 24 hours after the event has finished, and you need to be able to
straight on a flight back, get the fuck out of the country, basically.
Yep,
that's
straight out of the country. So there's going to be no. I mean, normally with the Olympics, even with Rio, when we did London as well, everybody went out and had a joke and had a great laugh. Rio was brilliant, nights out. Relaxing days, going to the beach, all that kind of stuff. See the city, see the country, experience the culture. Yeah. There's going to be none of that. This is work. This is work.
It feels like it's pure business because there's no spectators either, are there?
Yeah, I mean, there were allowed
pure business.
Up to 10,000 people. Now there's 0 spectators allowed. But you know what? I feel sorry for them. Like, there's an absolute emergency happening there. They haven't got anywhere near the kind of levels of vaccination that we have. They haven't got the same protocols put in place. I mean, even to the point that if, for example, you test positive, you have a 14-day quarantine over there.
Wow, that is high.
In elite sport here, we have like a 6-day test to release. So you'll have PCR day 2, PCR day 5, and if you're good, then PCR to release is day 6. And if that's still clear, then you're out. You're able to work within the bubble again. But they haven't got anything like that in place. So
which is interesting, because again, when you think about the Japanese these guys are techie, they're going to be on top of it. They know the Olympics is coming. They've had like a year and stuff to kind of.
I think the problem that
you would think this kind of stuff for the Japanese,
from the research that I've read and from the discussions I've had with the medical team, is that the uptake of the vaccine by the elderly has been very poor. Wow. So whether the government have failed in their explanation of what the vaccine is and why they need people to do it, or whether there's been a massive surge of people being anti-vaxxers there, the uptake from the elderly has been very poor there. And that's why we're seeing the differing in cases versus deaths. Like, we're still having less deaths than them, but we got way more cases. But it is what it is. I think everybody has to go through their own learning cycle. We've had our learning cycle, and we luckily have one of the best medical kind of facilities in the world. We've got the NHS, and we've got fantastic doctors and scientists that work there that are, that their sole goal is to make sure that we're, as a nation, healthy. whereas other countries may not have such a good system in place.
Well, Poora, you've made it to the Olympics. I want to go back to the beginning just quickly and understand how you jumped into the space of being an osteopath, because most people don't actually appreciate what an osteopath does. They tend to think you've got a physio, you've got a chiropractor. So what's an osteopath do?
Yeah.
Is that a podiatrist? Yeah. Like I've heard people say all these things, and I'm like, no. You have to like go and see one, and you'll see that they're levels ahead of those guys.
Yeah, I wouldn't say that. I just think that I think that you chose to come see us at my clinic, and we're
I did. But also, I've experienced all those pools of people, and I'm like, nah, I think osteopaths are clear. Like, not even a question.
So I think if I go by the history of it, so osteopathy started like 150, almost 200 years ago, and it was started by some medical doctors in America, where at the time the use of adjunct medicine in terms of like working on people with structural pain, biomechanical issues and stuff like that was pretty poor. Getting people on traction and all that kind of weird stuff. So they just basically started looking at anatomy and looking at how joints function, and then started to relay that with neurology and how that could affect certain things. And it was all rudimentary. There was no research. And they found that by physically working on people's joints and getting joints moving better and helping with kind of mobility and then making them do the right sort of stuff, it kind of it helped them with their general health. And that kind of like is where the real origins of it are. Chiropractic started around the same sort of time, but in a different part of America. And some say that it was just a group of guys that half of them went with chiro, half of them went osteo. I think the critical difference between osteo and chiro is that osteopaths work on musculoskeletal, so we work on muscles, joints, tendons, as well as the skeleton. It is more based on spinal and joint based work. But again, it's like qualifying as a doctor. You qualify as something, and then your clinical practice and your interests take you into realms of where you can get better and how you want to practice your medical side. So I started osteopathy. I was going to do dentistry. My dad's a dentist. I was going to go into the family business, do dentistry and all that. And I did my A's, got offers, and I messed up one of my exams. I remember I messed up the exam and I missed on one grade. And I was like, oh. And at that time it was tough, man. You could put 6 on your UCAS and then that's it. And then I saw that I resat those exams, but on the second time around, you only get 4 options to do dentistry. And so I had treatment from an osteo. I had discussions with an osteo. I'd seen chiropractors, and it was something that was really interesting to me. And I guess I kind of like, I just thought, well, I've got this opportunity here. Let's see what comes forward. I'll put 2 for osteopathic medicine and 4 for dentistry and see what happens.
Yeah, because you had 2 slots spare. It makes sense. Yeah.
Yeah, and so lo and behold, I got the offer for osteopathic medicine, and I was like, all right, let's go with it. And I remember starting the degree. I think about 3 months into the degree, I was like, yeah, I did the right thing. Like,
don't forget about the first day. The first day you told me. There's a weird thing that happens on the first day. So I think you should tell people about it. So the Wi-Fi cut out. I've got to start this again. But Poora, tell us about the first day on your university. What happened? Because it's a bit of a weird story.
So imagine, like, you first day uni, you've all gone in lecture hall. There's maybe 11 females and 15 males. So we're all sitting there, and they were like, oh, and it was brand new degree at a brand new kind of like facility, and they were like, oh, welcome to osteopathic medicine. And I chose one of the older schools to go with more about osteopathic philosophy and the kind of like the way of using techniques that so anyway, so we're sitting there in the clinical room now, or in the lecture hall, and osteopathic medicine, everything's brilliant in there. And they said, okay, can all the men stand up, please? So everybody stood up, and they said, right, okay, could you all walk to the front of the classroom? So we all walked to the front of the classroom. Now imagine, like, you have no concept of what you're going to be doing, and they all then walked to the back. The lecturers plus the females stood at the back, and they said, okay, can you guys all strip down to your underwear, please?
Okay.
And I was like,
ragging, man.
And I honestly, obviously, first day at university, dadi dodi ki.
Yeah,
the bugs everywhere, the beards everywhere.
Looking, and they were like, we were like, what? Can you strip down your underwear? And I was like, okay. So
everything comes off.
Ready.
Jesus.
Took about 8 minutes, and we stood there, and they just stood and they looked at us for about 30 seconds, 40 seconds, and they said, okay, great, you can put your stuff back on now. Put our stuff back on. And then we all, like, obviously the lads looked at each other and we're like, wow, okay, that was a bit weird. And then we sat down and they said, right, can all the ladies stand up? And we were like, no.
Strip show,
right?
Day one.
No, they listen. All the girls went up the front, and there was one of my best friends at university was a woman called Mira. She came from Malaysia. She was in her mid-40s. Yeah. She had 2 masters in 2 different science fields, but her kids had gone to Epsom Grammar School, and she had just come for 5 years to stay with them while they're at grammar school, finishing school. And so she decided to do an osteopathic medicine degree just because she was bored. So she, Bachari, was in a sari.
Wow.
And so they all walk up to the front. They say, right, can you all remove your clothing down to your underwear? And in the first time you do this, you're like, no, you just didn't know where to look. You're like, and like they're embarrassed, we're embarrassed. So
the dignity, everything. Okay.
Right. And so we were thinking, what the hell is going on? So then they put their clothes back on, and everybody sat down. The head lecturer got back up again. Quentin and Helen, they went to the front and said, right. So it said, sorry about that, but that's exactly how your patient's going to feel the first day they come to see you.
Wow. That's powerful, man.
So we want you to completely absorb the emotion that you felt there. And we want you to be fully aware that within 10 minutes of you meeting a stranger, they're going to be stripping down to their underwear for you to treat them.
Yeah.
So you've got to be able to get over that emotion and also be empathetic to that emotion.
So both sides, because you got the one there where you said, well, you took the kapre off, the clothes off, and then you were watching. So
and you had to watch.
Both sides. Which is also kind of uncomfortable, isn't it? Especially with the opposite sex as well.
It was. We all had a big giggle and a laugh about it. We all had a joke, and then, about an hour later, the stress actually kicked in. The emotion kicked in, and it was like, wow, that was powerful. That was really, really powerful.
I wonder if they still do that now.
I don't know, but ever since then, mate, when a new patient comes in, I always give them full dignity. Like, guys, look, if you need to remove your clothing for me to examine your hip, but if you feel uncomfortable, you're more than welcome to leave it on, but I won't be able to complete everything that I need to do.
Yeah.
And if you want to bring a pair of shorts in and make it comfortable for yourself, more than welcome. I also have a chaperone. It really drove your thinking in terms of just the empathy first. Then we went into the clinical.
Yeah, of course it is.
And I really, really liked that. I thought it was really, really good.
But day one, man. Wow.
I was day one, Pa. I was like,
day one,
never met these people before. You start thinking about shit. What underwear was I wearing? Everything. There was,
was it the granddad underwear? Was it my night out underwear? That's what you got to ask yourself.
The weirdest thing is, fast forward 6-8 months, and every day you're stripping down to have techniques done on you and practice this and practice that.
Yeah.
It's funny. You walk in and like half the people are in the underwear, lying on a treatment table, looking at the notes that are put up. The other half are playing with their ankle and playing with the toe, and no one's really bothered. You became so used to working
desensitized,
which is good. Good.
You completely don't see it. And which is it's a powerful skill to have, and obviously doctors get it. They you guys do it in hospitals. You examine whatever you need to examine, and I think that comes with practice.
Yeah, and because I think from a patient's perspective, when you're comfortable,
really steep learning curve.
Absolutely, when you're comfortable as a clinician, and the patient just feels at ease, man. If they feel like he's done this 100 times, manipulating or examining or palpating, whatever it is. I know that, and to be honest, I don't know if he's the same thing, Poora, but I try and lighten the mood. I always have good trying to banter with the patient, speak to them, lighten the mood, and then they're just like, oh, okay, I understand now. But some consultants, they come in and they need to listen to the heart sounds, and for a lady, that's quite obviously near the breast tissue, and sometimes if they're not mindful and tactful in the way they do it, it can be a bit like they go a bit stiff. Whereas if you explain this is what I need to do and this is why I need to do it, once funny story, guys. So when you examine a lady, one of the heart sounds is under the breast, okay, on the left-hand side.
The left side,
the correct way to lift the breast, to listen to for the heart sound, the mitral area, is the back of the hand, right? Lift like this. This one medical student, Jara, I don't think he'd been taught how to do this. Someone had played a prank on him. He genuinely thought, lift the breast tissue, you pinch at the...
You pinch at the nipple?
Yeah, so he's about to do it, and I was like, what are you doing, man?
Oh,
and he was like, oh, Jazz, this is how I've been taught. I was like, no.
No, you've been taught. Someone really had you on to see how long this would last for. Jesus.
Yeah.
I'm surprised you didn't get sued. Mad.
Yeah, bro. Everyone's happy, okay? It's all free, okay? Everyone's happy.
Just about.
No suing.
You guys were talking about some other topic until I jumped off. So do you want to pick that back up?
We can. So I realized that actually Poora is very, very well connected. And Indy, a chap I was speaking to a couple of weeks ago.
Yeah.
As you know, one of our previous guests, Indy, was Dino.
Yeah.
Dino and I have that coaching program we offer, Ultimate Contribution Uncovered, which helps people align with their values, their mission, uncover the direction for their life and what's most meaningful to them. I was saying to Poora that we are looking to take this work now to elite athletes in various disciplines. Yeah. And currently we've got Monty Panesar, whose radio show went on, and we've signed him up and we're taking him to the program. And now we're looking for inroads into athletics, boxing, and that's obviously why I had the conversation with Mike. And the way I met Mike, I was, I think 2 years ago, I was one of the ringside doctors at the amateur boxing finals. And there's a lady, I think her name is Lindsay Lockie. She was there. There was this old school judge. And I was sitting next to him. It was the finals. And this guy looked like, Rocky's trainer, Mickey.
Yeah.
That type of Bazorgana. And Bertazzi, he was sitting next to me, guys. And I said, Mick, listen, I want to get into, GB, and who should I speak to? This old guy, right, just literally pulls out his card, turns it around, writes his number down and name, says, speak to this guy. Literally, dormant.com. Like, he's been in the game for so long. That was Prof. Loosemore.
Mark Loosemore, okay.
And that's obviously how we had the introduction. But when you jumped off India, I was just saying that I was sharing the idea briefly with Poora. I think when he comes back to the Olympics and he has a bit more time, it's definitely worth having a good exploratory chat about synergy.
Mike's a great guy. Has worked with GB Boxing for donkeys. He's connected to CHP in London. The CHP boys down on Holly Street. They're all a great bunch as well.
CHP or who's
Centre of Human Performance. It's like a physio clinic, but they've got physiologists. They're basically, what they do is they run a lab similar to what we use with athletes. They use it there for general public, and they're a good bunch down there. James Moore, Mike Loosemore. They're all a really, really good bunch. People I hold in high regard.
Just out of interest, are you a tennis fan, my friend?
I used to play a little bit, not a lot.
How about watching?
I'm one of my clinics is at the Priory.
Oh, okay. Well, obviously we're this
time.
But do you watch tennis?
Yeah.
Okay. The reason I ask, so yesterday, I ended up watching his documentary on Prime about Andy Murray. It's called Resurfacing. It's about his hip.
Very powerful. Right. Very powerful. And James Moore's his physio.
Right. Okay. Perfect, man. So again, I was watching this. I got really inspired, man. I was like, obviously, I'm watching Andy Murray for a long time, but this journey was so intimate, so personal. And I didn't realize the degree to which this guy, the amount of rehab he was doing, man. Like when you actually see, there's the rehab side. And then from my point of view, I was like, my God, the nerve ablations, the manipulation, what else did he have? Obviously, in the end, he ended up having his joint replaced. I was like, bloody hell, man, this guy.
What happened to his hip, actually? Was it just ruined?
He had
what did happen?
Yeah. He had like a massive labral tear, didn't he? Have a huge labral tear, and then I haven't read the details of it, but that could have gone on to cause, or I think potentially gone on to cause some femoral head damage. And so every time to load on that hip, his body would just give him the worst pain ever. Because there's bad pain and there's pain where your body just says no, actually don't put pressure on it, and bone pain is not good to have. And so I think that's why it got to that point. And then for him to elect to have all the ablation done and then to have all the other procedures done and then go for a replacement, mate, the guy's got some some cojones, man. He's got
He
some
does, man. In order to go through all
mindset,
that and
you
still
know.
try and come back, it's insane.
And he's still playing. He's still playing.
29
James
years old,
is a
man.
fantastic. Yeah, and James is a fantastic guy to be working with. He's a great. He's probably one of the best hip physios in the country.
Wow.
Yeah, it's probably hip and groin. Hip and groin is his speciality, and so he's probably one of the best in the country. And like physio is very different to like MSK medicine, and like you'll find now more and more that a consultant will have a physio that they work with, because they realize so they realize that the effectiveness of their surgery and the longevity of their surgery is massively aligned to the extent of the rehab that the person is doing. Wow. So you could have a labral tear in your shoulder. Sorry, you can have a supraspinatus tear in your shoulder, and elect to have surgery, or not elect to have surgery, and in 5 years' time, the outcome is pretty much exactly the same. You did physio, and you're in the same sort of place as the guy who had surgery, and there's absolutely no association with you getting better faster with having the surgery. So all of this stuff's now coming out regarding MSK and surgery. And they're realizing that actually it's all about when you're in pain. Yeah, when you're in pain, you inhibit yourself. You don't move. You lose muscle tone. You use proprioception, and all the neural. It's the neural side that's the most important, not just the muscle mass. Just the all the receptors that are within the tendons, and all the proprioception that you're not getting. Even the quality of movement that you do after, if you're not training, is so poor. The likelihood of you injuring is massive. So
massively higher. Okay.
So they're realizing
a couple of points there, guys.
It's a life. It's massively important for the rehab to be bang on, and the person to understand that this is ongoing. This is not like I'm going to do it.
Yes.
It's like
I think that's what came out in the show, man. I mean, the show, Indy, if you've not watched it, I mean,
I'm going to watch it. Like, I'm massively into stuff like that. So yeah,
every day he's working with a physio, and he's working with these other guys. He's in the water. He's doing resistance training. Like, it's a full thing. And yes, the surgery they show is a few hours, but most of the rest of the show is not about the medical import in that sense. It's this ongoing thing. And to that point, Poora, so my mum, I reckon she had a rotator cuff injury probably a couple of months ago. Was getting a bit of pain when she was trying to put her arm behind her back, just couldn't do it. Right. And so, obviously I'm a hospital, I'm around Tino consultants. I was like, what do you think? Just like you said, one guy was like, just do physio. That was a registrar. Consultant was like, yeah, do an operation, do some sort of subacromial decompression to shave the bone down.
It's weird how you get such two massively contrasting opinions.
Right. And then I sat down with actually really good physio, Tom, and he was like, he gave mom some exercises to do, like more basically to do with resistance, and started getting better. But the best thing that worked, basically signed up mom with my PT, who's your PT as well, Indy, and my PT. And this is going from mom couldn't shoulder press on a machine to now having full motion. This is within a month, and now lifting weights.
Yeah.
No pain at all. And our PT is very good. And he essentially just said, that's exactly what I'm doing. I'm just moving the joint in a controlled way, adding, weight bearing to it. And it's just
resistance to it. Yeah.
Can't knock it, man. Like, it really, really changed the game.
My argument to the consultant would have been, so with that subacromial decompression that you're going to do, what are you basing the shape of the compression from? Is it from lack of muscle tone? Is it from pain? Is it from she's got actual congenital change to the bone? Has she had was she born a little bit misshapen like that? There's so many aspects to that bone's rubbing against that. So if I rub that and I get rid of it, you won't have the rubbing, you won't have the pain. That's fantastic for about 6 months, but I'm interested in how she's going to be in 5 years. And
exactly, longer term.
That's the weirdest thing about the consultant, because the consultant just said, without even looking at it or doing an assessment or anything, he said the operation. I was like, you've got to assess it on a case by case basis.
There's a shoulder surgeon I need to introduce you to guys to. There's a very good friend of mine, very close friend of mine. His name's Professor Tony Kocha, Poora Singh, and he's a shoulder surgeon at the Shard in central London.
Yeah,
right.
And he's actually on the journey of the last 5 years I've known him. He's actually gone and started an MSc in strength and conditioning.
Nice.
So he's going to be qualified in strength and conditioning, as well as being a professor of sports and exercise medicine, and also being a very, very good consultant shoulder surgeon, which I don't think there'll have been a surgeon like it. And he's very, very interesting to talk to when it comes to shoulder rehab and doing stuff. He's very much hands off first. And let's see what your commitment is. How committed are you to getting out of pain? Right, go away for 6 months, do this on a daily basis, and then after that, if it's still hurting you, then let's see if we need to get in and do an intervention.
So the comparison again for me, Poora, would be the patients that come in borderline type 2 diabetes, right? And you got the people with the mindset, I must do something, I don't want to be on metformin tablet, It's like, okay, well, you need to lose weight, you need to adjust your diet, but how are you going to do it? Let's make this tangible. Like, what are you actually going to do? Are you going to start learning how to prepare food and stop buying convenience food? The people that value delayed gratification can actually get into that mindset and build in accountability. That's the key, building in accountability. If they'll do it, we know it works. We definitely know it works. But like I said, a lot of the time, the problem is people want instant fix.
It's just about building up good habits. It's very difficult to build up good habits with people. Of course,
they don't want to change the bad habits. They just want something that allows them to have the bad habits.
That's it.
That's where the tablet comes in. So I guess it depends.
And I think when we in terms of what we work when we're working with elite athletes, right? People always ask me, like, what are their mindsets like? What are they like? And I was like, well, when we say to the athlete, if you make this huge change, you're going to get a 1% change in your sprint time. Every single one will do it without a second thought. 1% for a 1% change. Whereas when you're working with general public, you're like, well, you know what? If you stop eating so and so on a Friday night and stop doing this, whatever you're doing, then you know what? Your back pain probably, won't be as bad as it is, because you'll be a bit more active, a bit more strong. But if you do that, then you'll have 25, 30 years of less pain in your life. They won't do it. And that's
incredible.
That's the key difference. That's the key difference, is that I love working in elite sport, because these people are hungry to be the best human specimen that they can be. We've got I always tell people this analogy. This analogy is basically, it gives me motivation with my work, and it gives me solace as well. I have a number of athletes that will spend 4 years training a week for little or no money to be able to run one 10-second race. They'll spend 4 years training to get to a place where they can race for 10 seconds.
Incredible. When you put it like that, it's insane.
Just think about it. They will spend this Olympic cycle was 5 years.
Yeah.
Next year we have the World Championships, and we've got the Commonwealth Games. So there's no recovery from this year. You got to race this year, and then you have about a 6-8 week turnaround, and we're into winter training, and then you're going to be competing next year. So this is really going to separate the not so great from the great. Right? Because normally you have a 4-year cycle. You have a 4-year cycle. The first year, you're just coming off the end of of an Olympics. We'll give them 2 months off. 8 weeks, you got chill, relax, do whatever you want. A lot of them won't go crazy and go drinking and all that sort of stuff, because they're just not of that life.
Yeah. Of course they're not, because if you're so used to training all the time, it doesn't appeal to you. You're so acclimatized.
Well, you think that, Indy, but look at some of the boxers, man, and people like Ricky.
But boxers aren't training for 4 years, though, are they?
That's the difference. Boxers train hard, man. Their training camps are long. But I agree with you.
I have a what's the word I'm looking for? I have a thought about that. Why specifically boxing? Why is it that we see these boxers turn into these big, unhealthy, chunky guys? I think most athletes will agree that when you retire, there is a massive hit to your what am I? When you're an athlete, you have your day. When you're an athlete, you have your day set out for you. At 9 a.m., we're going to do this. At 9:14, you're going to start doing your stretching. At 9:36 is when we're going to start putting some plyos in. At 9:54, we've got to be putting your spikes on. We're ready to do some running, right?
Yeah.
So they have this regiment. When they retire, that's gone. And then there's this identity crisis. What am I now? I was an athlete. What am I now?
Well, that, I mean, what you've alluded there is one of the reasons why we do the work we're going to speak about. It's that their life span is so short. And again, this is one of the reasons why we approach Monty. It's like you spend your whole life to be elite, playing in Ashes cricket, playing against the best, and Sachin Tendulkar out. And then the next moment, you're not playing cricket. And then it's like, okay, so what's the next? You still have life to live. So what are you doing with that life? So you're absolutely right. Yeah, it is that. And especially boxers, man. Boxers like Tyson Fury, he went big. Prince went big.
It's like that with pro footballers as well, though. Some of them either stay strict and they keep doing it, Ronaldo, or some of them blow up like massively.
Ronaldo.
But I'd have to add, in football, the PFA and the Premier League have put in place organizations that are designed to guide the players after their career into other aspects of the sport. So become
that's actually really good.
Become a manager, become this. They've done that. They've seen that, and I have to admit that they have done extremely well. Like when players, while they're actually playing professionally, can do their badges. They can do their badges, they can do their coaching badges, management badges. So when they decide to retire at 34, 35, they can go pick a team and go in as an assistant manager. Not a big team, but a small team to learn the trade. And you've got a focus then, haven't you? You've got a lot of focus, a direction. Regiment. By the time you're 40, you've got a regiment. That's it. And so they've done that. But other sports are way behind. Other sports are very, very way behind.
Absolutely. This is the thing.
I know you've worked with Aston Villa and Birmingham City. How did you get those inroads? Or how did you make those inroads to be able to get into those spaces?
So like I had quite a successful clinic in Birmingham City Centre. I was working for somebody else, and I had a lot of athletes come see me there. And then I kind of like decided to set my own up at the University Medical Centre in Edgbaston, which was attached to the university. So I got a lot of sports people coming in. I was working with 7 GPs, and basically I just said to the GPs, just send me any MSK stuff you've got, anything that you don't like treating. Or you're not too worried about, you just everything you don't like, send it to me. MSK.
And GPs must love you, man.
If this is what it did. You see, like I really wanted the GPs. One of those GPs went off to the ROH and got involved with another exceptionally good sports physician, Rob Chakravarti, and then Rob started to refer patients to me, and we started to kind of like do a lot of work together. And then he sent me a footballer, and this footballer just happened to be from Blues. I treated the footballer, and he said, you know what, we need this kind of work in. Then I had to work with the medical team, and that was it. And then I walked in, and people find,
the signal's breaking up.
Take that very seriously in medicine. And in osteopathy anyway, I don't have any. No, this is what I think. This is what I think that they respond to. Have I broken up?
A little bit. But I think we managed to get the gist of it. It's cool.
Okay. Yeah. So and literally just snowballed as I started seeing. I started going into the Blues, but at the same time I got the gig with the European Tour and started. I set up. They wanted to set up a kind of a medical service for the Challenge Tour, and it was just like a massage service at the start. And I said, no, we need to go better than this. So we integrated osteopathy, then we integrated some nutrition, then we integrated psychology. We've integrated, now it's a full performance medicine system. We've got S&C coaches, we've got biomech guys, we've got pathology, we've got surgeons that come in, with hand surgeon, we've got a foot surgeon that will come in and talk to the players. They can get all sorts of support. And so, I know the aspect, or I've worked with the aspect of elite sport management and how to kind of like put together very, very good management for these athletes on all levels. And that's what I did. And then, obviously doctors talk and physios talk, and whenever the opportunity
goes up, isn't it?
If like, so Aston Villa must have spoken to someone at the Blues and said, we need an osteo, and they said, yeah, we've got this guy. They made the call, and I started going in. And so I've been working on, Jack and Tyrone and Ollie Watkins, all these boys for the last 3 years.
That's incredible, man.
Amazing, man. Very inspiring.
They all know things now. They all know.
They know who we are now, mate.
They all know Gurdas, man. They all know Punjabi. I'm a big personality.
When I see a video and Zaki and I see them all coming out and I'm saying Fateh, and saying happy Vaisakhi to all the things, I'll be like, this is Poora's work, man.
No. There's more people behind. There's more people. That's Punjabi villains. That is. Punjabi villains are a good bunch of lads, man. They really push that side, and they will. You know what? It's very inclusive. I got to admit, Villa is a very nice place to be. They're very inclusive, very aware, and they've got one of the sports scientists there, Aman. I don't know if you know him. Aman is I've known Aman since he was 14, and he basically did his degree, went into sports science, then went into the Blues, and he was there at the academy. Now he's part of the Aston Villa team. He's one of the senior sports scientists there. He's doing he's going to do his PhD soon in sports science. He'll be a force to reckon with in sports science in football, and he's a Pramunda. And I get pumped because, like, for many years, I was like going into these places, and there's no upgrade here. There's no singing.
Of course not. And now it's starting to.
Yeah,
it's different.
Exactly.
And now it's starting to allow us more into those spaces, which is really big. Makes such a difference, especially seeing our time.
You must know Gurj Bogle.
I don't.
No. Which space?
Is the England cricket doctor?
Oh. Yes, I do. I don't know him, but I know of him. Yes.
Yeah. So, like, I mean, Gurj is one of the doctors. There's a couple of doctors in there, but that's about it. In sports, there's not much, man. And we need representation. We need to go in. We need to showcase our skills and what we can provide the teams with. So that's why I've really pushed my team into sports. So all the lads and the girls that work for me. Have all been given opportunities to work with Team GB and football teams and athletes and MMA and all sorts. And I'm a massive advocate of, open doors.
Of course, that's massive because you're essentially kicking the door down. You're not even opening them. You're kicking them down, just getting everybody in, which is great. Yeah. It's really, really rare to see.
Yeah. And it's just lovely.
This is why you're on the podcast, man. You're exactly the type of person that we want to showcase, to show to people that your story is unique, man. It's okay. Maybe dentistry is traditional, but obviously it's come from your dad. But then there was this, whatever the spark was, man. You had this. This is what I want to do. You got the verification, that validation, like you said, within 3 months, and you just trailblazed since.
Literally, and it's not. I don't like. Obviously, your money isn't it? So you thank every day, like that this is how Maharaj has sent it. But I think with that, the fact that you do thorough work, the fact that you like your level of what you consider to be good is set high. So when I work, like I won't. I set my standards really high. I'm very hard on myself. That now this needs to be better. I need to know more about this. I need to understand this. And people see your work ethic and they see the way that you are. And I'm not afraid to say I don't know. So they see that you're egoless.
Yeah, which is important. A lot of people are scared to say that.
Sorry, if they come in and they've got a complex ankle injury and I have absolutely no clue, I have not the foggiest, I will say, lads, I have no idea. And I won't, and it doesn't affect me in any way. It doesn't affect my ego in
integrity. Yeah. Actually, if anything, within healthcare, it's a great thing because a lot of people, it takes so much confidence, to understand limits of your own practice and where to become resourceful, refer.
Which you wouldn't think
to work out.
You wouldn't think that's a thing.
No, because people assume, if I go and see patients, and just like you, bro, there are some patients that come in, man, and on a ward round when I'm seeing patients, there are some that are so complex. Like I have to read 10, 15 letters. I have to see what they're coming this time. A person can't speak to me, so I have to take a collateral history from somebody else. And this is within the realm of seeing other people as well. So it's like, but I have to give that time and attention. And only after that, I can then be like, okay, this is what I perceive to be the issue. Now I can start looking at the thing. But there are so many people who, this is NHS medicine, because of the pressure of the time, they will basically, like they have a rubber stamp, they'll have this algorithmic approach to certain things. Like, oh yeah, we'll do this, this, and this, and this, because that's what we do for everybody, which takes out the skill, takes out the art. So absolutely recognizing what you don't know and then saying, okay, I don't know, but this is what I'm going to do to find out. That's what people appreciate ultimately.
Yeah. I think so.
Was that like a similar thing with how you made it into Team GB as well? So it was just word of mouth and reputation that built up.
Yeah. So I was, the first sport I worked with was athletics. The first athlete I treated was in 2000.
Yeah.
And so like, you know, I was treating sprinters from there. The sprinters then would tell the coaches then would involve the team. I've been the honorary vice president of Birchwood Harriers Athletics Club for about 10 years now. And we at the clinic, we sponsor a lot of the junior athletes that go through Birchfield, just because it's my first sport. It's the sport that I learned about human performance from. And because of that then extrapolates, and that just goes. And so in athletics now, I'm known pretty well, I believe, like from the work that I've done. And you know, before just after London, I was asked to join the medical team as in performance sport. And so I did the cycle of the whole of Rio. I did the whole cycle of Rio, and then we went to Rio and we did the whole of Rio Olympics. That was probably one of the hardest things I've ever done in my life, to be fair. Three and a half weeks away from home. Just the intensity of the work. You know, when you're working in clinic, it's easy. You go to clinic, you see the patients, you leave the clinic, you come home, you're at home. But when you're on camp, you know, like, you know, midnight, if an athlete's hurting, they're gonna knock on your door. So
you're on call.
I was
You're on call
6 a.m. You're on call. And you know, you're stressing for the athlete, because you're like, shit, this person needs to be ready in 2 weeks, right? And we need to do X, Y, Z. So caseloads of all these patients that you really want them, you know, they've done 4 years. You know, what you do over the next 2 weeks may affect their performance in 2 weeks. So the intensity of all of that, and then obviously you're with people that you don't live with, you don't know. The medical team become your family, and then obviously there's issues that can happen, people's personalities, and then as soon as the cracks start to happen, you know, people then start
very quickly.
Sorry, 1 second, my battery's just said that it's going to stop. 1 second, I'm gonna see if I can get in and get it plugged in.
Yeah, I'm just saying that must be a really difficult environment to go and work in, because imagine having to go and work in a difficult place of that kind of ilk.
Yeah, absolutely. And remember, if I'm the person at the top, right, and I want to design a dream team, I don't really care about how well people are going to get on together. If it's a dream team, and I'm just going to put the people together, I'm going to say, right, you need to gel.
Yeah.
But again, if you're just being pulled, and remember, your outcome is how well is the athlete going to perform.
Just give me 1 second. I'll be with you in a second.
Yeah, go on. Yeah, no, but it's, at the end of the day, if you're putting together a dream team, you have to just allow the personality thing. If you know they're good at their craft, the athlete is only going to work with that person one-on-one. And when they're working with that person one-on-one, the athlete isn't going to care. All they want is just the outcome.
Isn't it?
Team dynamics is something that you're left to deal with. You just got to deal with it and just put up with it and figure it out.
Yeah, exactly. And at the end of the day, you know, it's a job ultimately. And so there's a certain professionalism and professional courtesies that you have to do. Look, you have a job. I mean, when you go into the office and I go into hospital, some people I don't like. Right?
Yeah, man. That's just how it is.
It's just how it is. Exactly. But there's a skill set in that as well. And I think nowadays, actually, the people's ability to be around that, right, and be okay with it is a lot less.
Yeah.
And that's
especially if you're in a foreign country as well. Like, imagine just being abroad with like a bunch of people you never met, having to try and understand their personality traits, seeing if they're like a bit of a normal person, or if they're a bit weird, or if they're a nut, or if they're like drinking all the time. If they're really against the things that you do, it's not going to vibe, is it? You're like, oh, this is going to be quite difficult. So I get it.
Exactly, because obviously the other side to it is a lot of excitement. I can only think. You know, you're in the Olympics.
Yeah, of course.
You're seeing what's actually happening kind of behind the scenes, right? But you're intimately involved as well. So it's privileged, but it's always, you know, the grass is always greener. What we see is the experience.
Which no one ever sees. Like none of us can see that. It's only by talking to someone like Poora who can tell us like all these little.
I'll tell you what, this guy we were talking about before, his friend, colleague, Prof. Mike Lusmar, you know, he said to us on this call, he said, Jazz, you know, elite athletes are not fit people. That shocked us, right? Because everyone thinks they're fit. Because you look at the joints, you look at the things they're using, they are, you know, they're being drilled in one discipline, whatever it is.
Yeah.
So it's not about them being, no, it's not fit, sorry. They're fit. They're not healthy. He said there's a big difference between being healthy and being an elite athlete. But again, when they hang up their boots, right, and you know, like Andy Murray is a great example, man. 29 years old, was the world number one, has won Wimbledon titles, and has excruciating pain at that young age. And the last part of the documentary, he basically talks about when he went for the operation, it was more like, before he had it, he kind of said, people have this operation not so they can go play tennis again. It's so they can live the rest of their life.
Pain-free.
Pain-free. He goes, that's the outcome now. He goes, everything else is a bonus, man. And they show right towards the end, basically, he has the operation and he starts playing a little bit. He's pain-free. And he's like, look, if I win stuff, that's fine, man. But if I can just play and enjoy being on the court and stuff. And he was at Wimbledon this year, he got to the third round. So fair play to him, man. This is a guy who said, I'm done, I'm finished, 29 years old. Plus, it's his style of play, man. His style of play is very rugged. Like, he runs.
Yeah, he does a lot of explosive movements. Like, that's how it is.
Yeah, absolutely, man.
I think Bordash just jumped off for a couple of minutes, but that's cool. I think he'll be back. If he isn't, it's cool. Like, that was massively insightful, no matter what. Top guy, man. Honestly, top guy. Garen, I was gonna say we've got a bunch of good guests coming up, man. So I'm pretty excited about them.
Who we got coming up
for the coming weeks? Well, I'm not gonna tell people that. Obviously, you gotta stay tuned.
Build up the hype, man.
A couple of musical personalities. Obviously, we've had Poora on, and we've got a few other people that we're reaching out to that are well known in their respective spaces. So that'd be great.
I heard.
What did you hear?
That Dr. Jazz is going to be on the show.
Who?
Dr. Jazz.
That's you, mate. But okay.
I love it, man. I love it.
Hey,
he's back. Sorry.
All good, man. All good. I had my blackout. You had your blackout. We're even now. Okay. It's cool. So you're saying that it's difficult to go abroad and to deal with all of those personality traits. What's the hardest thing you find about balancing all of that, like going across the world as an osteopath, but also having a suitable family life at home? May have dropped again. Could have been 2-1. It's now 1-1. Could be 2-1 to me. I don't know.
What about if I score? What happens then?
Oh, mate, if you score, then it's a full bingo card, man. That's what it is.
Oh my god, 2-1-1.
It's a full bingo card of everybody dropping out, man. That's what it is. It's cool. It happens.
Full Monty, yeah.
The full Monty. Oh, nice phrase there. Nice phrase.
Yeah.
Oh, separate note. Saw Space Jam yesterday. It's a good kids film. That's what I'm gonna say. It's a good kids film.
You said to me, I think it was you said to me, don't waste your time watching it.
I don't want to watch it, but then my niece and
was it you?
It was me. Yeah. Because I heard it was really bad, and I took my niece and nephew to go and see it, and they really liked it, and I just appreciate it for what it was. A kids
nostalgia,
film.
man.
Like, it's not nostalgia. It's not made. It is kind of made for me because they did have a lot of references to like the Looney Tunes and the Warner Brothers worlds. Like that makes sense, but it's not as simple as simply saying like, yeah, this is what it is. This is made for me. It's made for kids to enjoy and sort of resonate with that message.
Yeah, but it's not obvious. Of course, it's made for kids. It's not made for you, is it?
No, it isn't. Because if you watch films like Frozen, they have like an adult personality to make it more applicable to you.
You're saying, okay, it works on different levels. You're saying this doesn't have multiple levels. This is really mainly for kids. That's what you're saying.
Sort of, yeah. But there's a lot of nuances in it. Like, for example, there's references in it that you won't understand because you're not a basketball fan. But I understand because I'm like, oh, I get that. I get that line.
Give people some context. I wouldn't understand because I'm not a basketball fan, but you'd understand not because you're a basketball fan, because you're a player, right?
No, I understand because I watched. I understand because I watched the NBA. So, for example, they talk about the main guy, King James. He changes teams a lot, and they make like a number of jokes about it, and they say like really in-depth jokes that only certain people were going to get if they really follow basketball.
He allowed those to happen.
Yeah, obviously he's fine with it, but then if you're a kid, it's going to go right over your head. You're like, oh, I don't get that.
Yeah, exactly. In the same way that Toy Story had, you watch it when you're old and you're like, man, this is a deep ass film. Levels, isn't it? Yeah.
Which one?
Toy Story, man, the first one.
Toy Story. Oh man. Oh.
Toy Story is awesome film, man, but it's levels, isn't it? Like it's just deep. It's really deep.
It is a massively deep film, man. Even this film has like a lot of deep meaning behind it. Like you watch it, you're like, oh, that makes sense. That makes sense. That resonates with me, etc. Like it's all cool. Like I get it.
How was the actual basketball?
It's like have you ever played NBA Space Jam? NBA Jam?
Yeah, back in the day. Yeah.
It's like NBA Jam, but on like another level. They've taken it up more levels. So the way the format of the game goes, I was like, oh, that's cool. That helps.
Okay. How was your boy, LeBron?
Top notch as always, man. Top notch as
always,
man.
Love it. That needs to be your catchphrase.
I did that twice now.
It's all right, man. It's cool. Don't worry.
2-1 to the champion.
So the question I have was, what's it like balancing going across the world to all these events as an osteopath and then having a suitable family life at home? Obviously, the more and more you've done this over time.
It's really hard. Really hard. The 3.5 weeks you're in Rio, I was in Rio. I think I got to about week 2.
Yeah.
And I was not in a good place. I was really missing home, really missing my kids, my wife.
Yeah.
That support network and the FOMO, massive FOMO. Fear of missing out on what the kids are doing. Loads of stuff, and it plays on you. Then obviously everybody's upset when you call up. They're upset, you're upset. Sometimes things can be mistranslated over text. And,
I get it.
Yes.
All of these little holes everybody falls into that amplified 1,000 times because you're around people that they aren't your family.
Yeah.
Right.
And by the end of it, I made some lifelong friends, but I also got rid of some people that were toxic.
Yeah.
Right. Okay.
So I'm very much I'm very much like if you don't add to my
value,
if you don't add to my picture of life, and if I find
if you're not filling up my cup, if you're taking out my cup all the time, then off,
but also I think more than that, it's like the way that people can sometimes taint the picture that you have of the world.
Yeah.
And their energy kind of just doesn't align with yours.
Mm-hmm.
Oh, the dookie people who just put you in a bad state, man.
Yeah.
Ruin your day. You're just like, why are you going to be so negative, man?
We've all got that uncle, we've all got that auntie, we've all got that cousin that you speak to. Within 30 seconds, you feel like shit. Oh man, what the fuck are you doing?
Victim mentality, just the world's against me, and I don't want to.
Yeah, I'm not that way inclined, and I'm not. I thank my guru every morning when I wake up for taking the first breath. So for me, I started a winner. I wake up, I started a winner, and my day can only get better. So I just even with the most massive stress and stuff like that, I just find that I just can't. And some of these people were very toxic. Some people were outwardly trying to break up relationships and stuff like that, just because that was their nature. And they were called out, and we fired them. And there was
this is in again when you hopped off. But I was just saying that from an outside perspective, we see what we see on TV, but we don't see this type of stuff, behind the scenes
stuff.
And again, your primary outcome, I presume all the medical staff and all the people that work with you, is performance, right? From the athletes. Yeah. But all these like hidden agendas that you're talking about, like you said there, so somebody who's trying to break up another relationship, not for any other reason than that's in their nature.
Just simply to cause the masha, or just to cause
I mean, the psychology of it, there's even coaches that, when they see that there's a competition, when they see that one of the athletes could potentially beat their athlete, there's little silly things they'll do, move a hurdle, a couple of inches too close.
Oh, wow, that is super petty.
God.
Yeah, I've seen loads happen. And look, Appa Senga. Right?
Yeah.
And I take that serious, man. You see something wrong going on like that, you go
you cut that out straight away.
Yeah, Kanda comes out straight away with me. Straight away. Appa, we're
talking about a real Kanda, or you mean like the spiritual Kanda?
The metaphorical Kanda.
Spiritual Kanda, man. Your heart, man. Like, at the end of the day, it's a level playing field for everybody. We have ekta, we have oneness. Everybody is equal. Right?
Yeah.
And so anybody who doesn't have that in their psyche, and there are psychopaths walking these streets, there's psychopath coaching people, clinical, but have never been diagnosed, right? These people exist, so don't ever think that these people aren't. There's, just because you wouldn't lie to somebody and do something to hurt somebody
doesn't mean other people are going to do the same thing.
Other people are like that.
Yeah.
So And I'm very loyal and I'm very caring. I'm empathetic with the way that I am. So if I see somebody that's there actively trying to harm the group or people within it, I'll call it out straight away. There's no fear there. You straight away it's called out.
Right.
And so there's loads of little layers in sport. It's mad, and it's crazy how, like, when you look at medical departments, you've got these very senior physios and doctors at the top who mate, they don't want somebody to come and take their job. Right?
Oh, God, that's horrible, man. So they want to keep the power all to themselves.
They want to keep the power, and they've got the ear of the gaffer, and they don't want anybody to come and upset him. Even if the guy is like hasn't got the greatest clinical skill, they still want to take the job. And on a level, I get that. Everybody's got to feed their kids, right? So I get it. But if your job entails clinical practice and you are not doing the best
of your game
clinical practice, then you need to be called, man. It may not be your calling to be a physio or an osteo or a chiro.
No,
and with that in particular, so who is that decision maker that will actually look at who's the compliance person, within a team like yours that's actually looking at, and I kind of outlined, we have appraisals and you've got to make sure that you're up to a certain skill base, and obviously for you guys result oriented, I presume, like if you're not getting results, then so who is that type of
so you have the head physio, then you'll have the chief medical officer, then you'll have head of medical services.
Right, and these guys are also horizontal? Or?
These guys are all horizontal. They can't talk to each other. The CMO is always seen as the top guy, the chief medical officer. He's always seen. But I think that hierarchical system is based upon a hospital setting. And I think that physio and doctors within hospitals have historically been like that. But I know some physios that are clinically way better than any doctor I've met.
And right. I will echo that, man. I work in neurophysios. I've had, just this last week, I've had a young lady with multiple sclerosis. I've had another guy who's ataxic. I've had another person with a stroke.
Yeah.
And actually, where I work, I've got a lot of doctors are coming in from India, Pakistan, right? So we've got a lot of holes in our system, right? And from where these guys come, it is paternalistic medicine. It is very traditional, and there is resistant doctors at the top. I said, look, what you need to learn here is the power of leverage, right? Understand your skill set and hone down on what you are very good at. So, for example, I'm very good at managing teams. Very good, right? And I can put people together and that kind of thing. And if my physio has the knowledge, so George is one of my neurophysios, Spanish guy, lovely guy, and I say, George, what do you think about this? Can you assess, the levels? What do you think about the power here? This is what I think. I think he's got sensory level here. What do you think? And once you have that synergy and you have that connection, he's going to deliver, man. Like he'll come to me on the ward. There's respect. That's the thing, respect, and there's what's the word? Reciprocation. That's the word. And he'll be like, Jazz, are there any patients you want me to see? Or he'll come back to me and say, this is what I think we should do. And then I said to my doctor, look, I don't have to then chase after him. And there's no I have to go and read the notes. He'll personally come and tell me, and I'll personally go and tell him. It's about respect. Once you have respect, working just becomes easy. So I absolutely agree with you. This hierarchy needs to go. Absolutely needs to go. And I'm happy to say that the UK guys coming through now, it's more of their mindset. Even with consultants, man, it's like COVID was the best for this, man. And when I wrote some stuff during COVID, I was just saying how because of the pressure and because you had redistribution, there were surgical consultants who were needed basically medically, right? And what that meant was I had an obs and gynae consultant, Poora, so obstetrics and gynecology, 25 years in the game, up on our guy. I think his name is Dr. Mr. Baines. And basically he was with me and he was like, Jazz, look, I haven't managed general medicine 25 years. And we had this patient who had a high blood sugar, so hypoglycemia, went into a medical emergency called DKA, diabetic ketoacidosis. And he's like, Jazz, you need to teach me, man. I was like, yeah, bring up a chair, man. And then I was teaching him on one side.
That's
he's like 30 years older than me. I had a medical student who was acting up as a doctor now because we didn't have enough. And I was in the middle. It was weird for me because I'd left medicine to come back in. So I was rusty as well. So I was the senior most medical guy with these two people.
You're not selling the NHS to me, Corinne. You're making it sound like it's proper fucked up.
Nay. Listen. So we banded together. There was no hierarchy. The nurses, everyone. We were doing, I wouldn't say we were doing Simran together, but in the mornings, basically, we get in a room together. We were doing affirmations together. We were doing all our mindfulness together, and we were one unit, man. There's definitely ekta in that. And now, beyond COVID, it's we've carried that on, especially in my unit. So absolutely, I love that.
I 100% agree with you, buddy. 100%. And I think there is this change happening, and I can see it happening, and I think that it can only be a positive change. It can only be like the recognition of people like for myself, like so osteopaths themselves to be like there are osteopaths working in the NHS now in London, and so people are seeing it as a clinically
recognized
effective tool to be used.
Good.
So we know when we're good, we know what we're good at, and that's why I said to the doctors, I said, look, just send me the MSK, the stuff that you don't like, and then I'll filter it and send you back what I think needs to go for an MRI or may need some bloods because this doesn't look very good.
Right.
You know what I mean? So we can do all of that, and we'll take that load off because that's what our specialty is.
What does MSK stand for again?
Musculoskeletal.
Oh, nice. Okay, I would never have guessed that. I'd have been like, God knows.
Medical lingo is like a different is a whole language.
It is a different language, and I'm going to be the one to ask because otherwise you guys can fall into it, right? It's very easy to go ahead and do that.
And so otherwise now, I mean, like with sport, it's very interesting. It's very interesting.
Are you going to carry on and do the next Olympics as well after?
I don't know yet. we've got Commonwealth Games next year.
So but that's in Birmingham though, at least.
Birmingham,
I don't know if that's any better.
I'm going to be involved. It's my hometown. It's something that, I don't think will come around again.
No, it won't.
I think there's going to be a lot of investment put into the city. I think the city needs to stand
It's already happened. You've seen Great Bar. It's a mess.
I understand that, but it's still nothing compared to what Manchester did.
Yeah, really? Was that really bad?
So I think I'm a massive Brummie. I'm a hardcore Brummie, and I still think that Birmingham City Council could do a shitload more to promote our city, because this opportunity doesn't come around a lot.
Make us the real second city, man. Because I agree with you. When you go to Manchester, you see it, and I felt, wow, this is like London, man. Like it's got that vibe. And then you're in Birmingham, and you're like, maybe that one little area around Edgbaston, right, which is a little bit cool. Apart from that, nothing, man. What really says that we are the second city? I don't get this one.
Because for decades upon decades, they've just been so horizontal. Oh yeah, we're Birmingham.
New Street. No. All you focus on is New Street. Let's make
all we have is around New Street. I brought people from London because my missus is from London. She says there's nothing to do in Birmingham, and I'm like, you know what? I can't really argue with you compared to London. There's not the same comparison. If I take you to Manchester or Liverpool, you might get the same kind of differences. You might get a bit more culture and stuff and vibes, but in Birmingham you have to know the city inside out to take them to the right places.
And the things are happening in Birmingham, but they're just not promoted.
No.
Birmingham City Council does not know how to promote Birmingham. That's it. Simple.
Marketing. It's a marketing.
And I'm going to throw this out there as well, that London are shit scared of Birmingham. If they allow Birmingham to have all of that, we've got an international airport, we've got every single motorway running through us, we've got universities that are top tier, we've got schools that are top tier, and we've got beautiful areas around Birmingham that you can use. So if we were given the funding from central government, and if we were promoted in the right way, London would lose a trick.
Would it though? I don't think it would.
You heard it here first. Now Indy's piping in now because he's moving to London, Poora. He's a traitor. That's what it is.
Indy, we'll see how long you stay there, bro. We'll see how long you stay there.
Mate, I'm staying there because my missus lives there. I'm staying there. There is no coming back, right?
I'll see how long it takes you to realize that sitting for an hour on a tube to do 6 miles against people that actually don't really want to be there because they can't really afford to live there.
But now I work from home, Poora, is different.
Listen, you heard it here first, man.
We'll see what kind of place you're going to be living in for the money that you get in Birmingham.
Right. What's the date today? The date today is the 19th or 20th? 19th of July, 2021. Put this date in your calendars, guys. We're going to check in with Poora and Indy in a few years' time, and we're going to look at his, let's call it life quality satisfaction.
My life quality is...
Me and Poora will design a questionnaire, okay? Design a questionnaire for this, and we'll measure it.
Days in London. So I used to do a day in London a week.
Yeah.
Right? And it used to take me an hour and 22 minutes from New Street to Euston.
Virgin train, man.
Another 10 minutes, 11 minutes to Harley Street.
Right.
So within an hour and a half or thereabouts, I'd be at work. I used to live in Kingston, and I used to travel into central London to work. Kingston's 12 to 13 miles away. It used to take me an hour and 5.
Yeah, that sounds about right.
All right. So there's no comparison. I could do 120 miles and get there in 1 hour and 20 minutes. Or I could do 6 miles at 6 in a sweaty cabin. No, man, forget it. I'd rather have a nice small house here with a nice bit of garden and a bit of fresh air.
Garden, yes.
I get it.
He needs the car, man. He needs the grass.
That's right. We need to come on, man. That's where we're from, bro.
We need it, man. Exactly, man. Exactly.
We need that.
Oh, I love it. All right, Poora, we will let you go. But before we
wait. One thing. That thing, man, that happened to your back here, and you made me drill you with that machine gun.
Yeah.
You need to go to the professor. Yeah, tell the story, man. You need to go to the
Theragun. So I had this rip-off Theragun that my dad had, right? And I couldn't get into a position. So I went to Gurren's and I said, yo, can you just put it in a certain spot for me and just release it? He's like, yeah, I'll do it for a little bit, but if my dad walks in, it's going to look super dodgy, so I'm going to stop. Like within a second of him starting to do it, his dad walks in and he said, no, I'm not doing this now. Boss.
Your university day one, yeah, you taking kapre up, you instructed. I turn around, yeah, he's there, Nanga. He's like, God,
I'm not Nanga. I'm my top off, right? Levels, I'm my top off. But yeah, man.
Oh, man.
That's what it's about.
Listen, Theraguns make you feel good. That's it. Like there's not much research to suggest with percussion therapy it does anything to the muscle or anything else. Okay. Maybe a little bit of stuff to the neural side, but we tell everybody whatever feels good. There's nothing wrong with use it, man. Just do it.
This was a Theragun though. This is some knockoff one that my dad got. Like same thing.
Hammer, basically hammering it. Oh man, you must see those videos, man. You know those videos that go viral. Of like osteos, like they're obviously not osteos, but they got like the sculpting tools and like doing this in the spine, and I'm like, yo, like, actually there's levels, man. There's levels. There's like you said, people come to me like cannabis oil and cannabis oil, and doctor, what do you think about this in cancer? And listen, if it works, it works. But if somebody asks me about that, I'm like, no.
Well, this is it. I think America has all of that stuff, man. You got all these guys, PTs and chiros and osteos, they're all doing the weird and wonderful things. People are doing all sorts all over the world, man. Bottom line to me is that as long as you do no harm to the patient, as long as you're not doing them over, and as long as in your mind you've got a good clinical plan and they're getting better, then just carry on, man. Like I said, if my athlete wants me to light tooth and rub mustard on the tail into the
mustard, guys,
and they believe that that's going to make them run sub 10. Guess what I'm going to do?
You're going to do it.
right. Here's right, Poora. You're going to hear this secret advice, which I'm going to give to you, which I gave once to our Bhangra team. Okay. Now, this is obviously a complete joke, right? But the person I told took it completely seriously. So in Bhangra, when we get ready for comps, we have a lot of soreness, muscle soreness. Yeah. I told our captain that the key to not having soreness, particularly in your calves, is to get old yellow dal, because it's got a lot of protein, and just lattan mal de, and obviously because of the credibility as a doctor, and we made it really. There's another guy with me, and so we said it has to be old, tin din ali dal. 3 days minimum old, because the protein. We said, look, so much protein in the dal, you need to get it in the leg, he tried it. So you tell that man, sub 10, if you want to go sub 9, dal.
Terrible.
That's an abuse of power right there, man. That's an abuse of power right there.
Completely cool. The GMC call right there.
Yeah, man. Fitness and practice.
Right, Poora, prior to letting you go, I've got some quick fire questions to ask you. Just some quick fire questions just before you go. All right, tell me the first answer that comes to your mind. All right. Okay, what's your choice of music when you work out?
Bhangra.
Ah, yes. Artist. Tell me your favorite artist.
My God. Sukshinder Shinda.
Old school, man.
Old school. All right, acupuncture.
That's it.
Acupuncture or deep tissue work? Which one do you prefer?
Deep tissue work.
Okay. Bearing in mind that Team GB had picked up 67 medals in the 2016 Olympics, how many medals are they going to pick up in Tokyo?
Ooh. Prediction time.
I hope we do more. I hope 68.
Okay. Who do you think will have a breakout performance at Tokyo 2020 or 2021?
A breakout performance. Aaron Jamili.
Okay, I'll keep an eye out. Keep an eye out. Which background are they on?
200 and 100 meter sprints.
Okay, fine. I'll keep an eye out for that. Tell me the favorite person you've worked with. Your favorite person you've worked with.
What, sports-wise?
Sports-wise, yeah.
Oh my God, that's a big question. I've been doing working with a lot of people, man. I would say, oh God. I really like working with the Villa guys, man. Like, so Tyrone, Anwar, Treze, you know, Ross Barkley, all these boys are like, all of them. I like working with all of them, and even athletics as well. Like, that's a tough question, man.
All right, okay. I'll give you a pass.
Cal Yafai, the boxer, you know.
Yeah. What's the advice you wish you gave your younger self? Just one piece of advice.
Trust yourself.
Powerful. Advice for the next generation of osteopaths coming through?
Trust yourself. Find a good mentor and keep your hustle high.
What's your biggest pet peeve about seeing patients?
Say it again?
What's your biggest pet peeve about seeing patients?
People that don't wash to come before they come.
I knew it. The smell
on the air.
I smell good. I challenge you to find a day where I don't smell good.
Even in 30 degrees, this man double shower every day.
Double, yeah, man. And you wash
double deodorant, everything, roll-on spray.
You're going to be treating. So at least have the decency to do it when you're coming to see me.
Yeah, agreed. What's your preferred brand of footwear?
Nike Air Force Ones.
Classic guy. I like it. And what's the thing you miss most when traveling for a competition?
Gardi roti, man.
Home roti. Love it.
Yeah, buddy.
Love it.
That's it, man.
That's it, Poora. That's it. Thank you for your time. I appreciate it.
Lovely, man.
Cheers, guys.
Catch up, yeah?
We'll chat soon. All right. Cheers, guys. Take care. See you next week.